Good morning. The topic I'm going to cover today is about surveillance and monitoring of AI. I would like to start by the outline of my talk. We may have to think about the principle of the surveillance first. Then, because I'm not from the University of Professor, so I'm going to tell you how we customize it in Thailand. Okay. So, from principle, you have to do the design of your surveillance system, and then after you design it, you just have to implement. Then, after you implement, you have to evaluate. The result of your evaluation going to reflect your design. And you have to keep doing that until you got something that's really practical and works for you. Okay. So from the principle of the theory, there's many international standards like OIE Health Code, EU legislation, something that you can use as a reference. Okay. For surveillance of Avian Influenza, there's a chapter on it, OE guideline. And for Thailand, we try to follow that guideline. Like we have clinical surveillance, active and passive surveillance, virological surveillance, and serological surveillance. Now, from the principle, this is how we customize it. Okay. Of course, we have to base on science, like the health code and all the reference I just talking about. And as Thailand is an exporting country, so another rule, we have to follow the importing country requirement, like the health requirement of the importing country, or they have their own standard. Moreover, we have our country policy. You have to follow the policy. If they give the priority or like economy perspective, and also the pressure, like a pressure from public. Usually for when there's human case, there's a lot of public concern, and they just like a lot of pressure from the public health side, and also the international community as well. Another factor is an outbreak situation, like if this is emerging, re-emerging, or already endemic in your country. The incidence is high, low, where high, where low, so you have to decide it. And how the outbreak distribute, like is a sporadic cluster, where is the high-risk area? These factors that you need to think about. Okay. Another factor is farming practice in your own countries. Like you have to think about biosecurity level, size of the farm, fraction of each production sector, slaughtering practice, market practice as well. And another thing is resources of your country, because nobody has unlimited resources. You have to think about your staff, laboratory, and budget. And of course, you need to use your own judgment from your experience, the result from your surveillance, the evaluation and feedback from the staff, the local staff and lab people. So I think that for AI surveillance and monitoring program, to customize it is more challenge than that you just follow the textbook. Okay. I would like to use like Thailand as a sample, and we have our national AI surveillance plan since 2004, and this is our condition. Okay, the policy 5-star, very good, high priority, because we are a big exporter. For outbreak situation is emerging diseases, we never found it. For resource, the field people, we got very kind of poor, not enough people, but lab is one of our strong field. And farming practice for breeder and broiler, okay, that's very high standard producer. Backyard, marginal. Layer, okay. And market chain for broiler, of course, is exporting, so it's high standard. And layer, layer farm in Thailand is like open house, so there's a kind of moderate risk there. And this is just to show you which sectors of production in poultry production in Thailand. And this is the national plan for avian influenza surveillance. First, you have to think about the objective of your surveillance. Okay, our national plan divided into two phases: pre and post epidemic phase. For pre and post, I think pretty much the same. It's peacetime. The objective of this peacetime is for disease detection, so for early warning, and therefore rapid disease control can be implemented. Area cover has to be nationwide. Timing and duration is like always, you have to do that. We also have intensive active surveillance, which is commonly called as an X-ray campaign. I'm going to tell you about that later. And this campaign is for evaluation and monitoring of disease control measures that being taken. And the area covered is we have to target because this is so expensive, so laborious. And the timing and duration, our policy said we plan to do it at least twice a year, okay, with a duration of probably 1 month period. And during the epidemic phase, the objective is you have to do whatever you can to rapidly control the disease at the source. The area cover we divided into the suspected infected premises and the surrounding area. Then after that, at least 1 month additional time is required to repeated outbreak and area zone. Now about the activities of the surveillance plan. Okay, for pre-surveillance activities, we have active clinical surveillance, okay, and passive laboratory surveillance. For active clinical surveillance means like the farmer or the villager or the local veterinary officer, they have to look at the poultry with clinical sick or something like that. For then passive laboratory surveillance, this is become mandatory to our laboratories in DLD network, that every lab in our network, if they have a poultry cases, they have to look for AI as well. Okay. Also, we have pre-movement and pre-slaughter testing. DLD will not issue the movement permit if that farm doesn't have the result that show the negative for avian influenza virus. Okay. And also have the health monitoring system, like production monitoring of the farm, that the vet can go there looking at the chart in front of the farm to see the water uptake, the feed consumption, and to just at least they give you a clue that it's going to be a problem or not. And then for intensive active surveillance or the X-ray campaign, the routine surveillance has to be done as the same as always, but we add intensive active clinical surveillance into this program as well. Also, the active laboratory surveillance. Okay. And during the epidemic phase, okay, at the outbreak area, we have to do, and the area surrounding within 5 kilometers radius, we have to do the active laboratory surveillance. Every farm, every village in that 5 kilometer zone has to be examined for the virus. We also have active clinical surveillance as well. And other areas outside that kilometer zone, the same as routine. Okay. This slide shows our surveillance during the epidemic. The 5 kilometers radius of the stamp, we have to sample every farm, every flock in the 5 kilometer zone we're taking clinical swab and for the virus isolation. And for the 10-kilometer radius, we have to do that movement prohibition for 30 days. And for this outer 5-kilometer radius, they have to be put on the clinical surveillance. Okay. Also, another measures that will be implemented is the restocking has to be done like after 90 days, after last stamping out. Here again, this is the same, but I just want to emphasize that which activities do all year round and during the X-ray. Okay, all year round we're doing active clinical surveillance, passive laboratory surveillance, movement control, and monitoring. During the X-ray, we do all of that I just mentioned and strengthen active clinical surveillance as well. Also, we have active laboratory surveillance program. And all year, we select some virus to do molecular epidemiology study. We think that the most effective strategy measures to control the disease is the intensive active surveillance or the X-ray campaign that has been conducted nationwide at least twice a year. Okay. The objective is for early detection of new cases, detection of asymptomatic reservoir, because we found in some bird species there's no clinical at all, but they just keep shedding the virus. We also want to evaluate and monitor the effectiveness of the disease control measures as well. The design and planning of the intensive surveillance, okay, we go back to the principle. For epidemiology principle, you have to think about animal, place, and time. For the principle about the time, okay, there's a scientific information report about seasonal pattern of the outbreak. And you also have to use your own experience, for example, incidents in the past. Okay. At the local practice like Chinese New Year, where you expect a lot of poultry movement, and the policy said at least twice a year. That's another factor. Okay. And scientific information show seasonal pattern of AI virus in south of China. The more virus were detected during winter, starting in October, where temperature dropped. Okay, winter is the time that the birds from the north migrate to their habitats in Thailand. So we plan one round of the X-ray during around this month. And this is epidemic curve of HPAI outbreak in 2004. And this, you can see that this support the observation from the previous slide. Okay, now about the time that we should do the X-ray campaign. How about the location? Okay. As mentioned by other speakers, surveillance is laborious and expensive, so we should target the population and locations. For the X-ray campaign, we divided our 76 provinces into high risk, moderate risk, and low risk area. And you can read from the slide that how we classify that. Okay. Then we have to think of the animal population to be targeted. We look at the specific risk group and also look at the biosecurity of each sector as well. Okay, this is from our own outbreak. This chart shows that more than 70% of affected species was native chickens. Another specific risk group is free-range duck. They can be infected with no clinical sign. They act as a silent reservoir. During the campaign, specific risk group with low biosecurity will be targeted for laboratory surveillance. For example, every duck flock and backyard in every village will be examined while in commercial farm with a higher biosecurity, they may be randomly selected. The active clinical surveillance, which is a door-to-door survey. We have village volunteer around actually 2 people shot to be 1 million. This village volunteer will go around to every household and check if there's any dead or bird, sick or dead bird dying in that household. Okay, and we also do the active laboratory surveillance as well. Okay, and because we are using village volunteer, they are not trained veterinarian or paravet, so we have to establish the case definition that is very simple for the volunteer. Okay. For our case definition for poultry that raised in a farm, for mortality of higher than 1% in 2 days, or feed consumption reduced 20% in 1 day. They just look at the chart. Okay. For backyard poultry, mortality more than 5% in 2 days, and sudden death or show some sickness, any kind of sickness. Then next, after the volunteer observe the death of sick bird, which they have to visit the household of their responsibility every day. One volunteer will cover 10 to 15 houses. And once they spot the case, they have to report it to the local vet officer. The vet officer will come and verify case. Okay. Then we have to develop another case criteria for local vet officer. Okay. If the case was verified, the local vet officer can launch AI control measures right away. They don't have to wait for the laboratory confirmation because that's going to be too late. Okay. So here we need a legal definition because to be AI control measures, including stamp out, that involve compensation as well. So we have to make the definition legal so we can pay compensation, and the consequence, we have to declare the surrounding area, the control zone, and nobody can move their poultry from that zone. So we have to make sure that the law endorses it. Okay. Then after they have to report. For active laboratory surveillance, the local vet staff, they have to go out and collect the specimen according to the design plan, as I already told you how we design it. Okay, and the lab analysis will be done by the DLD laboratory network. We have one national reference lab in Bangkok and 7 regional laboratory centers, and they have to send report to the AI Operation Center in Bangkok. And this slide just shows the locations of our laboratory network. Okay. This is the result of our X-ray campaign. So far, 3 years, we have do 7 times, and the number of cases going down, and each time over on average 60,000 samples will have to be examined during 1 month period. Okay, again, this is one is all year round activity, one is during the X-ray campaign, and we will do molecular epidemiology study. Okay, for molecular study, there is some specific site that we must look. The site that tells you the pathogenicity in avian species, in humans or other mammals. And also we have to look at the site where they can tell you whether the virus is resistant to the antiviral drug. And once we have interesting genome, we will select some for whole genome sequences. Okay, and this is criteria for selecting isolates. Because we have thousands, 6,000, 5,000. So The criteria for selecting isolate is at the repeated outbreaks or the new province that never have the outbreak before or somewhere close to border, because Thailand have 3 sites that border to our neighboring countries. Okay, and of course we have new species, infection in new species. This virus has to be thoroughly studied, and I think that all human virus from all human cases should be thoroughly examined as well. And this is the result of the molecular study of Thai H5N1 virus. On the HA gene at the cleavage site, receptor binding site, it confirmed the multiple insertion of basic amino acid, which is confirmed the highly pathogenic characteristic of this virus. And at the position 226, there's no mutation. On the NA gene at the stalk region, we found 20 amino acid insertions, but neuraminidase resistant markers not found. That means that also Tamiflu still work for the patient. On PB2 gene at position 627 we found in all human isolates. Okay, but some of you may know that we have cases in cat and tigers as well. For isolates from cat and tiger, 50% of those isolates has this E2K mutation, but 50% doesn't have. And none of these mutations were found in the avian isolates. Then on the non-structured protein at position 92, we found aspartic acid at this position, which is different from the Hong Kong 1997. On M2, we found a amantadine-resistant marker, which we found in all isolates from the first isolate in Thailand. Okay, and nucleotide sequence also tell us the kind of the lineage of the virus. As you can see that Thailand, Vietnam isolates cluster in the same group, and quite different from Indonesia in 2005, and quite far away from the virus isolates from EU, and which is from Qinghai Lake in China. Okay. This is the same confirmed things, but the H5N1 isolates from 2006 is quite different. We have 2 outbreaks last year. One isolate from Pijit province, which is in the central zone, the orange zone there, which is a repeated outbreak zone. This isolate is similar to the one we found in 2004, 2005. But the isolate that we found from Nakhon Phanom province, which border Thai and Laos, is different from the virus in 2004 and 2005. But it's quite similar to the Shenzhen isolate in 2006. And the map at the corner show you the location of this city in China. And latest outbreak is just in this January 2007. We're doing the X-ray again because close to Chinese New Year. And we found 2 cases. One case, the first case is confirmed in Phitsanulok province, which is the repeated outbreak zone. And again, we have another case found in Nong Khai province, which is again close to the border. Now from the design of the surveillance system implement, now we get data from local livestock office and data from the lab. Then someone at the head office had to analyze it. And this is quite a challenge for staff in the headquarters because we don't have enough staff to do this thoroughly. And then after analyze, we have to report the information. Okay. And we have the website we report. This is our daily report. Also the GIS coordinate as well. Now, how surveillance help? Okay, this is our 4 epidemic waves, 2004-2006. As you can see from this slide, that the locations of the outbreak is clustered in the central and the lower north region of Thailand. Okay. That is why the zoning will be the good approach for my country. So we set up 5 zones, and the orange color is the central zone, which is high incidence of the virus, of the outbreak, and the border is okay. And we also set up the checkpoint for animal movement control over there. So to prevent illegal movement from the central zone to the other zone and to coming in from other zone as well. And the surveillance that's sensitive enough, fast enough, will help reduce magnitude of damaging impact. For example, in the first wave of the outbreak, we were so inexperienced. So we got a big outbreak there. As you can see that we have to call like 60 million chickens there, and we pay compensation around 130 million US dollar. For the second wave, we're doing better. There's less case, and we pay around like 5 million US dollar. The third wave is even less and less. Okay. And as you can see in this slide as well, that a majority of the infected poultry is in backyard flock. Okay. Now, it's not only surveillance. HPAI control measures in Thailand composed of like stamp out, including carcass disposal and disinfection, quarantine and movement control, of course surveillance. With it has to be systematically and continuously, and biosecurity improvement and additional measures like public awareness campaign. This stamping out, cleaning and disinfection, quarantine and movement control, movement permit. And we even have issued this fighting cock passport, just like a tourist passport, because the fighting cock like to travel, because they like a boxer that have to go. And to improve biosecurity improvement, this is like commercial farm, and we can do it even in like this free range duck. Some of them already get into the house with financial assistance from the government bank. Backyard chicken, at least they have to have something to prevent them exposure to the wild bird. Like this is fighting cock racing that already improved biosecurity, cleaning and disinfection, and this is a raise public awareness campaign. Okay. We also have other campaigns, for example, a campaign on safety consumption of poultry meat, because during the time of the outbreak, people may lose confidence to eat chicken or chicken product, and that makes the situation worse. Okay. Now, because this is about AI vaccination, I have to tell you that AI vaccination in poultry is prohibited in Thailand. Okay. And however, plan for emergency vaccination was drafted in 2004. And we're going to use the strategic vaccination. We're not doing mass vaccination. And we already calculate our trigger point where we can tell this is going to be uncontrolled outbreak. And we have to do it, give the emergency vaccination before it gets to be too spread out. Okay, and we also have write down the specification of vaccine and draft the post-vaccination surveillance system, exit strategy, also logistic and budget. This slide may be too busy, but this is summarize everything. Okay, let's see if we have the outbreak here. Okay, and it become like hit to the trigger point. We calculate. We have our epidemiologists people calculate that if the outbreak going to level 3, we have to launch this emergency vaccination. What we plan to do is to do ring vaccination around the outbreak area of like 5-kilometer zone, and then the outer zone is prophylaxis vaccination in that province, the whole province. Okay, and after together with that, we have to check for the virus. If the virus is detected, of course that flock has to be stamped out, and the rest get vaccinated. Okay. And for the prophylaxis vaccinations in the province, we will vaccinate only specific risk groups, all flock of duck, fighting cocks, and expensive birds like zoo bird or endangered species. Okay. Then we need to have the post-vaccination surveillance and to evaluate vaccine efficiency as well. Okay. So for our vaccinated bird, we have to evaluate vaccine efficiency and to get epidemiological information. Okay. We have to do serology and virology assay. The sampling has been planned. We're going to sampling 20% of the village that we have in that 5-kilometer zone, and sampling 20 birds in a flock. And we're going to be checked 3 times at day 0, day 21, and day 60. Okay. For epidemiological information, we have to do DIVA assay. We have to differentiate an infection from vaccinated flocks. And we have to subtype the virus to see what is the virus is being isolated. The sampling frame is the same. But after 3 rounds of sample collection, for free-range duck, we have to collect samples, recollect the sample again every 60 days. Okay. For non-vaccinated populations, we still need to take samples for epidemiological information. Have to check for serology, virology, and the sampling frame, the same, 20 bird per flock. But for breeder and layer, which is like higher biosecurity, we're going to do it every 60 days. For broiler they live in high biosecurity environment. We already have the pre-movement checked. Okay. For backyard poultry, outside the vaccinated ring, we got to do the clinical surveillance because nothing else that we can do. Okay. We already calculate the budget sheet if we vaccinated. Okay. For this has been calculated in 2004, and at that time, 9 provinces was put on the high risk. So we calculated if like 9 provinces, how much money we have to pay. If we do the whole central zone, 21 provinces, how much money going to pay, and mass vaccinations. And for the 2-year pass, we never get the outbreak up to the trigger point, so we don't have to do the vaccination until now. I already tell you like how surveillance help. Now, I'm going to tell you what helps surveillance. Okay. Science, of course, we are scientists. We have to follow the theory, the recommendation, the expert opinion. Okay. That's the common ground for everything. Okay, I made this checklist just to compare with OIE code what we did. Actually, we did pretty much everything that in the code said, like structure, population, base, except these 2 ones, the specimen bank and Sentinel, because we're so busy with has nobody to develop that yet. Okay. And that's another guideline from another chapter, the guideline for surveillance of avian influenza. Okay, we do almost everything. Okay. And the second point is you have to know your own conditions. Okay, the favorable condition, non-favorable, your capacity, your limitations. And just like you have to manage the risk, you have to manage your limitations. Okay. Then, for example, we shortage of staff. So we use volunteer. Okay. And even for calling, we recruit soldier and police. Okay. And then you can customize your surveillance program to fit in your conditions. Then again, you have to evaluate and adjust to improve your surveillance program. Okay. This is a condition in 2004, as I already mentioned at the beginning. It's improving, like in 2005. Okay, it became from 2004 from emerging. It's turned to be zone. It's localized in the zone, and in the field we got more people, not from our own, but we borrowed, integrate the task force from other government agencies and using volunteer. And laboratory has improved greatly. What else? Backyard condition, biosecurity improved. Free range duck, fighting cocks, broiler, layer. Okay, 2006 is even more, improved. Okay, thank you for your attention.